When we first got married in September of 2012, we kind of knew we wanted kids right away. I knew that I was going to have issues because I had never had a regular cycle, so it was almost immediate that we knew we were going to need some kind of help or guidance. We had found Dr. Stroud, switched from a previous OB that we were using, and he diagnosed us right away with polycystic ovarian syndrome. So that was new to us. We hadn't heard about that before, but he described my lifestyle like to a T.
I did have a pregnancy, and I had a miscarriage. So, and we conceived on our own, and then after the miscarriage, we did more Clomid and more other things, and there was still no more pregnancies, and then that doctor was done, and I was referred on to IVF, and I knew that was not where I wanted to go. And I knew there was probably something else, knowing that I had PCOS, a different option. And that was when I consulted Stroud.
We immediately began in 2012 with trying different fertility drugs. The first year we weren't seeing any improvement whatsoever, so that's when we decided in January of 2014 to do the wedge resection. He thought I was a good candidate for it, and we hadn't had a response to anything yet, so we did that, and 2 weeks after surgery, I ovulated on my own for the first time.
We started with a Creighton model, we got that going, so that way I knew what to look for. And then once there was nothing coming of that, then we went ahead and talked about the wedge resection. And with the robotic wedge, you get to go home that night, unless you run into difficulties like I did. But the next day I was fine, I was getting up and it was better, and I went home that afternoon. For the first time in my life, I saw mucus, and we conceived that actual first ovulation, so exciting.
We worked on getting our progesterone levels where we needed to be, and by October of 2014, we still hadn't conceived, and we really didn't know why, so he thought maybe it was because the endometriosis had returned. So we went in there in October, and he found some more, so we removed that, and we were hopeful that that was going to be our key. And here we are about another year later. Still, we're in this unexplained infertility, not quite sure why we're not conceiving. My life has completely changed. I mean, I've lost weight since the surgery, everything. I mean, I used to spend ER visits every month, and it was just miserable. So now, I mean, my life is a complete 180 because of Dr. Stroud and his team, and we are forever grateful for everything that they've done for us, because we would definitely not be where we're at today.
Being successful and having a positive pregnancy right after surgery, which will not always happen, but there is hope, and don't give up.
It's hard, but to have them on your side, it's unlike any other, and there isn't anybody else that I'd want to have by my side to help deliver, what we hope to have our miracle children. So.
Yeah.